Hello, this is Sanjay Gupta at St. Luke's Mid-America Heart Institute. I'm the program director for the UMKC EP Fellowship Program. So the Mid-America Heart Institute at St. Luke's Hospital of Kansas City, we're the primary training site of the UMKC EP Fellowship Program. We're ranked number 22 out of all hospitals in the nation for cardiology and heart surgery by the latest issue of U.S. News & World Report. We're the largest cardiology group practice in the city with 65 cardiologists, of which 6 are electrophysiologists, and 45 nurse practitioners, of which 5 are dedicated electrophysiology nurse practitioners. We have 4 hospital locations with 12 satellite locations. We perform 700 ablations annually, and over 1,300 devices are implanted annually. We also have a large outcomes research group focused on producing about 180 publications annually on average, with a coordinating center for the National Cardiovascular Data Registry, along with Harvard, Yale, and Duke. So here's our program structure here. We've got a clinical track, which is a 2-year program now recognized by the HCGME. We typically take 1 fellow per year for a total of 2 EP fellows. It consists of 11 clinical months. There are 16 weekdays of vacation and 5 weekdays off for conferences. In the first year, 100% is at St. Luke's. In the second year, 80% at St. Luke's and 20% at a satellite hospital named Truman Medical Center. We're recruiting for 1 clinical spot this year via the National Residency Matching Program. So typical schedule for year 1, Monday through Friday. Most of the time is in the EP lab. We typically will have 1 half-day clinic in the afternoon each week. We also recommend taking at least 1 half-day. It can be any half-day, not specific to Thursday, but this is just showing at least 1 half-day we recommend taking for research, learning, just a break from the lab. There is didactic lectures typically on Mondays, occasionally on Tuesdays. Cardiology grand rounds is every Thursday, which fellows are encouraged to attend. And then the dedicated electrophysiology conference is on Fridays, which we'll go over in a second here. There is a call is from weekdays only between 5 and 10 p.m. So the consults are typically performed before and between EP cases. They're by the fellows. They're staffed with the EP attendings in the lab. It's a great opportunity to learn systems-based practice. Clinic is performed at St. Luke's Hospital in conjunction with the EP attendings, and also has opportunity to get experience in device clinic, also at St. Luke's Hospital, working with the device nurses. On the main conferences, the didactics are usually on Monday, occasionally Tuesday, and it mirrors the topics, go through the ABIM Blueprint of EP topics to make sure that the fellows are prepared to take board exams. The Friday conference schedule is a mix of interesting case studies that are presented by the fellows, as well as a journal club, which rotates between the fellows and the attendings to present. Research presentation by faculty or fellows, and then a quarterly morbidity and mortality conference. The call schedule is only from 5 to 10 p.m. and only from Monday through Friday. There is absolutely no overnight or weekend call. Fellows typically will take call a week at a time, but they can divide it up however they want. The call is focused only for management of post-procedural complications and to assist the triaging and appropriate care for those patients. There is a general cardiology fellow in-house that would be the first call, and then the EP fellow is available for backup if the general fellow cannot resolve the issue. It's expected that the EP fellow would involve the EP attending who did the procedure. In the second year, very similar. Again, majority of the time in the EP lab with at least 1 half day of clinic and 1 half each week, and then 1 half day of research every 2 weeks. The big change for the second year is we incorporate time at the Truman Medical Center clinic and EP lab as well too. Again, call is 5 through 10 p.m. only on the weekdays. Truman Medical Center is the primary teaching hospital for UMK School of Medicine. It was Kansas City's first hospital. It's connected to the medical school. It's about 10 minutes away from St. Luke's. It's a safety net hospital. It's a very different patient population, about 75% self-pay. And it's an important important complement to the fellow education. You get significant autonomy, which is why it's a second year only rotation, but you have an independent EP clinic in the morning, which the fellow can go and staff and can go and see patients. And then these cases are staffed at noon with the EP attending to review any of the teaching aspects and make any changes. And then that afternoon, they do device procedures with the EP attending, and typically the fellow is really the main person working them up and doing these procedures. It's a great opportunity to learn systems-based practice and doing inpatient EP consults. It's a very different population than St. Luke's, an urban patient population with unique pathology, and fellows spend about 20% of their time in the second year. A lot of our fellows have really enjoyed this experience as a way of sort of transitioning to becoming an attending. The strengths of the program are we have exposure to a high volume and broad variety of EP fellowship, of EP procedures. There's a culture of outcomes-based research and teaching that promotes an academic environment. Being a tertiary referral center exposes trainees to complex patient positions and management decisions to preferred graduates for any position. And the presence of numerous advanced practice providers and other staff maintains an appropriate balance of service and education in the fellowship. The electrophysiology labs at St. Luke's are 3 main labs that are dedicated purely for EP. We have labs 4, 5, and 6. They're all biplane. 4 and 6 have CARDO built in as their map system, and 5 has ESI or Precision as their map system. There's also a hybrid OR for extractions or structural cases. At St. Luke's East, we also do procedures there as well, which is one of our satellite locations. There's an EP lab there equipped with ESI as the map system. And there's also Truman Medical Center that has a cath EP lab that's shared, where also device procedures are done. We have several mapping systems, including CARDO, ESI, and Rhythmia, as well as 2 cryoablation consoles. We have exposure to both Abbott and Acuson intracardiac echo. The fluoroscopy systems are all Siemens and they're all biplane. We also offer exposure with laser lead extraction using a Spectronetic system. Showing one of the insides of EP Lab 6 in the middle of a procedure. Procedure volumes are very high. You can see the total ablations have increased year after year. Again, over 700 now, of which many of these are left atrial ablations. Total device volume has also been growing year after year. And even left atrial appendage exclusion volume is growing, and these are opportunities for fellows to get involved with these. We have the busiest program in the city. And just to show an example of a typical graduating fellow of the procedural volumes you would expect, again, most of the fellows prefer ablations, so they definitely get more than enough exposure to that. But even with the devices, you see there's more than enough devices and well above the need for graduation. That's not a problem. So in terms of the types of procedures you would get, there are things that you would get at every program, but also some things that are unique that we offer exposure to, like leadless pacemakers, his-bundle pacemakers, subcutaneous defibrillators, as well as exposure to atypical flutters, both endocardial and epicardial ventricular ablations, as well as there are things that are pretty unique to our program. We do get fellows exposure to left atrial appendage exclusion procedures, both the Lariat and Watchman procedure, as well as other procedures such as phrenic nerve stimulators for treatment of central sleep apnea, which is a new procedure. The culture of outcomes-based research and teaching promotes an academic environment is evident from kind of these new procedures. We're always being on the cutting edge, looking at new procedures to offer our patients, but as well as train our fellows. So example of that is his-bundle pacing, where we've really developed this and helps to improve fellow competency with this emerging technique. It does allow more physiologic right ventricular pacing utilizing the native cadencia system. It's associated with decreased instances of heart failure and atrial fibrillation. It may be an alternative to CRT, as well as we're also involved with left bundle branch block pacing. We've also been very instrumental in incorporating intracardiac echo to really develop low or zero fluoroscopy ablation procedures. We've through the use of both intracardiac echo and 3D mapping, we've done many with zero fluoroscopy and many with extremely low fluoroscopy. This both decreases risk to patients and staff physicians, as well as generates improved procedural efficiency and accuracy. We have availability of a novel technology, a Cardio Insight mapping system, which is it's a 3D mapping vest coupled with a CT scan to generate 3D anatomy. What this can do is a non-invasive electroanatomic activation map, as shown here. This is a ventricular tachycardia, originates from the left ventricular outflow tract. The additional learning opportunities consist of we purchase textbook for our fellows. We have access to online modules as well. There's board review materials from both Heart Rhythm and Mayo Clinic. We have an interning exam every year. We do encourage outside conference attendance and send many of our fellows to these seminal conferences, EP 101, Signal Summit, and Meet the Masters. We also have several regional conferences within Kansas City. There's a local electrophysiology society called the EP Masters that meets 3 times a year, as well as each fall there's a fellow-directed courses, one on cardiology concepts, looking at anatomy, lectures and procedure simulation, and then another one just on electrophysiology called the Kansas City Cardiovascular Summit. We're also a training site for cryoablation, Watchman, and fronting nerve pacing, and fellows are encouraged to attend those training examples as well too. Being a tertiary referral center, we get fellows get exposed to complex patient positions, management decisions to prepare for graduates for any position. So we have a large adult congenital heart disease population, and a lot of these have arrhythmias. So fellows will get exposure to treating atypical flutters or TACs and Fontan patients, ventricular tachycardia ablations, and tetralogy of Fallot patients. We host a citywide adult congenital heart disease conference every month. And there's opportunities to pursue a pediatric EP elective at Children's Mercy Hospital. We also have our large transplant center, performed over 800 transplants, average about 35 to 40 a year. There's a high incidence of arrhythmias in post-transplant patients, including sinus node dysfunction that often requires a pacemaker in about a third of patients, as well as transplant vasculopathy and cardiomyopathy requiring defibrillator implantation, and then frequent arrhythmias involving atriotomy scars generating atypical flutters. This is an example of one mapped to the posterior right atrium. Other components of the fellowship. There's a required quality improvement project for which the topic and mentor is chosen by the fellow. It's an example of a plan, do, study, act cycle where we try to address a quality gap, implement an intervention, and then analyze the results. There's opportunity to publish these as well too. Examples of this include MRI and non-conditional devices, preoperative management devices, or pacemakers after TAVR. There's also opportunities for research. Fellows can work on existing projects with faculty or participate in the outcomes-based research program. And they present at national conferences, and this is a recent graduating fellow presenting at the Heart Rhythm Society. We are developing a cardiac simulation center in-house to focus on procedure-based stimulation for ablation and device procedures, as well as computer-based simulation of procedures and patient care scenarios, and group-based simulation sessions for emergent conditions. While this is under development, currently we have access to the UMKC Simulation Center, which our fellows can get hands-on exposure to simulation just a short distance from the hospital. And our hope is that by building a dedicated center, this will really be a complement to fellow education. Here are some of our recent graduates. You can see that we've had fellows go into both academic as well as private practice positions, so we prepare you for both opportunities. Any of these graduates would be happy to talk to you about their experiences here, and I have their emails here, and you can certainly reach out to them for their opinion. As opposed to faculty, I'm the program director. Dr. Youssef is our associate program director. Alan Wimmer is the head of electrophysiology. Dr. Ramza is the chair of VP Research, and Dr. G. Kondo is one of our other electrophysiologists, and Dr. Sinas is our director of VP Quality, also does research as a clinical scholar. We also have several advanced practice providers that really help deal with the day-to-day management of the service and deal with a lot of the admissions, discharges, and doing initial workup for consults, as well as their wealth of knowledge regarding management of EP patients and doing device interrogations, and they complement your training nicely. We pride ourselves in being a very relatable and fellow-centered program. We have supportive leadership. We understand that connections to fellows are important to the success and happiness. We want our fellows to call us with any concerns. They can reach us anytime. We've got layers of mentorship and support. We've got our program coordinator, Jeanette, is a tremendous resource and a fellow advocate, and is a wealth of information as well too. Fellows have a really strong voice in all training program decisions. We're very responsive to fellows' feedback, and the environment is great. We actually all like each other and get along, which really makes the work environment a lot of fun. So with that, I wish you the best of luck, and hopefully we will get you to join us in our program here, but please email us with any questions that you have.